Hi, I'm Dr. Jim Hoven of Ramos Law and your host of Health Matters. Today I'm going to share with you information about a very special kind of doctor called a physiatrist. They manage pain, they do a great job, and they're a critical part of any kind of rehab team. We're going to talk about it right now. It's so often seen in our world here at Ramos Law that people come in pain. They've been in an accident, they've had a slip and fall, hurt at work, bit by a dog. All these things can cause all this pain. And oftentimes, there's several kind of doctors that get involved in these cases. One thing to know, as pain gets more chronic and as pain gets more complex, it often requires a different kind of doctor. So whether it be a primary care doctor or a chiropractor or physical therapist, they have a great effect on a lot of pain levels at the basic levels, even getting into the more complex stuff. But when those conservative treatments aren't working, that's when there's a very specialized kind of doctor that will be brought into the case, and those are called physiatrists. And essentially what they are is pain management doctors. But what these doctors do is they have a host of tools in their toolbox that can help pain in different ways. So again, assuming we've utilized the conservative approaches effectively and that they haven't worked, that's when we would step up to a pain management doctor. So what are those people going to do? Well, they might have some medications on board that allow, but by when you're getting a pain medication, that allow you to do more rehab exercises, and they might start there. But then they're going to watch for things like certain types of injections that they might do. They can do certain types of neurological procedures where nerves start getting what's called a radio frequency. They can start getting reactions from that, and even to the point where they can start doing injections into other parts of the body, including the spine, to help with distal pain. So pain management doctors play a really important role, and they're always studying the latest and greatest of how to treat pain that is not treatable with normal methods. So they are absolute heroes in the space of chronic pain management. In the case of acute pain management, a lot of times they won't touch that at the very beginning unless it's really significant and severe as a way to dampen or diminish that pain, and then they'll work basically in combination with the other providers that we talked about earlier. Again, your general practitioners, your chiropractors, your physical therapists, massage therapists, acupuncturists, those will all work as a team in a lot of acute cases. But when those things aren't working, that's when the pain management doctors step in and do their thing, leading all the way up to eventually then hopefully that it doesn't happen, but sometimes when you need a surgery, then that might go to the orthopedic surgeon, the neurosurgeon, that kind of thing. So that pain management doctor plays a critical role from conservative, non-responding care in between to try to solve the gap, to get people better so that they don't have to go to surgery. So I hope that's been helpful with you understanding a little bit more about what physiatrists do. If you have questions about this, of course, feel free to reach out. You can email me at jim@ramoslaw.com, and I'll help you in any way that I can. By the way, if you have something that you'd like us to talk about or that you're interested in, send us an email at that same place, and I will make sure that we get that on video for you. So I appreciate you watching, I appreciate you sharing, and always remember, your health matters.